Welcome to It's About Bloody Time, the podcast where we discuss all things endometriosis. I'm Mal.
I'm Emma.
I'm Michaela.
And I'm Jadyn. To kick off this podcast, we want to first start by defining what endometriosis is and who it affects. Endometriosis is a disease where the tissue of the uterus starts to grow outside the uterus. We'll be talking about it at the global level as it affects people all over the world.
Yeah, and to add to that, Jadyn, endometriosis affects every 1 in 10 reproductive age individuals. That means that in our English 112 class at CMU, at least one person is living with this disease. It truly is an astonishing number, especially when considering that a lot of people haven't really heard of the disease or know what the deal is around it.
Furthermore, endometriosis affects not only those living with the disease, but also the loved ones around them. In our podcast, we dive into different groups who had a stake in the topic surrounding endometriosis.
Did you know that endometriosis is often misdiagnosed? I know many of you are asking why, and what exactly are the symptoms and treatment options available? Join us in It's About Bloody Time as we dive into those questions regarding endometriosis and give it the proper attention it deserves.
From the silent struggles to the resilient fights of women all over the globe, endometriosis affects more people than you would think, and not just adult women. Join me on this episode as we shed light on the impact of endometriosis one story at a time. Hi everybody, my name is Mallory Christopher, and welcome to It's About Bloody Time. And on this episode, we will explore the effects of endometriosis on women as well as their loved ones. When people think of endometriosis, maybe they do not know much about it, or maybe they just immediately think of women. And while all of those thoughts are valid, I'm here today to discuss the recognition of loved ones, men and women who struggle to deal with this disease. Louise Moore is a 29-year-old female from the United States who has lived with endometriosis since her very first period at age 10. I've conducted an oral history with Louise to talk about and bring awareness to her story and the adversity she has faced throughout the years. The oral history conducted on April 21st, 2024, dives into the personal and emotional story of Louise Moore. She has had to face many different battles living with this disease, and I will be personally playing some of those stories for you today. Louise has gone through multiple doctors, multiple specialists, looking for an answer to her pain. This journey of hers has lasted almost 20 years. Louise also talks about the impact it has had on her partner and the dynamic between them dealing with this. One of the most impactful moments Louise mentions is the fact that she had to have a full hysterectomy because of her endometriosis. Here is an actual audio clip of Louise describing what it was like living with her ovaries having cysts on them and her ovaries twisted.
So continuing, so I went back to my lady doctor. They did a vaginal ultrasound where they were able to tell me that I had yet another cyst on my left ovary. And actually then is when I got diagnosed with endometriosis. So then I was referred to a specialist. So I went to a specialist thinking, just had a cyst. It is what it is. The specialist said, "Hey, surprise, your left ovary has twisted again. We'd like to do further testing." So I did some more testing, and come to find out, throughout my uterus and then also on my right side, I had scar tissue damage, and I also had miniature cysts is what they were called. So it was
So what you just heard is Louise explaining the beginning stages of her surgical procedure. As we fast forward a couple of months later, you'll hear her talk about what happened next.
Set my time for my left ovary to be completely removed. I was going to keep my fallopian tubes, my uterus, and my right ovary. And then I went in for surgery, and I woke up 3.5 hours later, and they said, unfortunately, when we got in there, due to the amount of endometrioma tissue, we had to take everything.
So what you just heard is Louise explaining when she actually got her full hysterectomy, and it was in the middle of surgery, and she mentions as well that nobody told her she would be having a full hysterectomy. They just had to make the critical decision while she was under anesthesia. So you can imagine waking up and all of your reproductive organs are completely gone. So Miss Moore's story is very impactful and very personal, which can help spread awareness about this subject. And while endometriosis can seem like just a bad period, it is actually so much more than that. Now, as we transition from people who have it to people who deal with their partners having it, I would like to talk about a UK study done on men whose partners have endometriosis. And while it's important to validate women who live with this disease, I would like to acknowledge their partners who are also impacted. This study, conducted in the United Kingdom, researched how men's lives are affected by endometriosis, specifically when their partners are dealing with it. The research provided in the study explores how male partners are negatively impacted by endometriosis within multiple aspects of their lives. These include sex and intimacy, planning for children, work, household income, support tasks, emotional impact, and lack of support. Each category is broken down and explored further and provides statistics for each in this research paper. The men that participated in the study provided their honest opinions and personal truths. Their identities remain anonymous. Quote, "It has been hard because, not that I would want it to be the other way, the focus clearly has to be on the woman for obvious reasons. She's the one in pain and discomfort. But you do at times think, what about me? No one's asked me how I'm feeling. There are times when you think the bloke doesn't get a look in." End quote. While women are at the forefront and the ones physically dealing with endometriosis, men are impacted emotionally, and that often goes unrecognized. It is important to recognize everyone that is going through different yet valid hardships relating to endometriosis.
Mom says it's a part of becoming a woman. Soon I realized it's not so simple. At school, I'll get such bad cramps. I'll often cry in front of my classmates, but I'll be dismissed by teachers and school nurses. It's just bad period pain, they'll say.
What you just heard was a sound clip from a TikTok produced by news.com.au. Endometriosis pain is often discredited as normal menstrual pain, but there is nothing normal about this pain at all. With a 4 to 11 year delay between the start of symptoms and the beginning of treatment, it is no wonder that women are fed up with the health care, or lack thereof, that they are receiving. Welcome back, everyone. I'm Emma Priske, and I'm here to discuss with you the global experiences of receiving health care for women living with endometriosis. This is It's About Bloody Time. In the last episode, you heard Mal talk about how loved ones are impacted by endometriosis. She conducted an inspiring oral history with someone who lives every day in pain caused by endometriosis. Today, I want you to remember Lucy's statements as we talk about the individuals who are affected by endometriosis. Endometriosis is a hidden chronic gynecological disease appearing in every 10th woman of fertile age. By hidden, I mean the symptoms often appear in ways similar to menstrual pain, yet oftentimes more extreme. With endometriosis, tissue like the uterus's lining grows outside of it. The cause of this is unknown. There is no way to prevent endometriosis, and there is no cure. However, symptoms can be treated, oftentimes through surgery. Symptoms of endometriosis often appear as extreme pelvic pain. Oftentimes, pain may be more noticeable during menstrual periods, during or after sex, or when urinating. Dr. Jess, a pelvic health doctor who actively shares videos to advocate for those with endometriosis and or chronic pelvic pain, produced a video explaining what her life is like living with endometriosis and what you should expect if diagnosed with it. Number 1, daily fatigue. She states that she often wakes up feeling exhausted despite sleeping all night due to pain. Number 2, severe abdominal pain and bloating. She states that this also leads to negatively affected body image and self-esteem. Number 3, along with fatigue, she's actively affected by brain fog, poor memory, and poor concentration. Lastly, Dr. Jess states that she faces anxiety, depression, low mood, and low libido as a result of endometriosis. While symptoms may vary, Individuals with endometriosis should expect to experience something similar to what Dr. Jess listed. Are these symptoms not extreme enough to receive adequate health care?
My stomach's being ripped out. They'll just send me home with Nurofen. It's just bad period pain, they'll say. In my 20s, I'll have surgery 3 times. I'll just get by at uni, because every month I'll be curled over on the shower floor as though my pelvis is being torn out.
Pain is not the only negative effect that individuals with endometriosis face. Among the misdiagnosis, undiagnosed conditions, and discredited feelings of pain, women suffering with endometriosis often experience troubles in terms of receiving health care. Through a study in an article titled, quote, How Women with Endometriosis Experience Healthcare Encounters, end quote, produced by Agneta Peterson and Karina Bertrero, both professors with PhDs at accredited universities in Sweden, it has examined how women with endometriosis pain receive and experience healthcare. Through this source, they examined 14 relevant studies produced globally that included 370 women diagnosed with endometriosis. The professors found that quote, the metasynthesis resulted in 3 fusions: insufficient knowledge, trivializing, just a woman's issue, and competence promotes health, end quote. Meaning that the experiences of these individuals were accurately placed in one of 3 categories. The women often stated that they had repeated problems, that the cause of the symptoms was unknown, and they had not been diagnosed. The women felt that the physicians lacked knowledge of the disease, which led to the diagnosis being delayed, and that they did not receive adequate treatment. In the trivializing section, the doctors had also believed that, quote, the problems could also be seen as mental. Some physicians thought that the problem was in the head and not in the body. The women were diagnosed with depression, or the physician blamed the symptoms on possible early abuse of alcohol or other drugs, on infection, or on previous miscarriage. Young women, students, were treated on being people who did not take care of themselves, end quote. When pursuing medical diagnosis or treatment, 2 themes often appear: being treated with ignorance and being acknowledged, which is, in essence, the double-edged experience of healthcare. This further solidifies the battles that individuals with endometriosis must face in order to receive proper healthcare regarding their illness. Overall, it is important to acknowledge the challenges that these women struggling with endometriosis face. Following these episodes, I want you, the audience, to help advocate for the awareness of endometriosis. And if there's anyone you know who struggles with endometriosis, hopefully this episode made you more aware of what you can do to make their pain a bit easier. Resources can be found through Endometriosis Association or endometriosis.assn.org.
I'll be let go from my first job, as just bad period pain is not an excuse for sick days.
What you just heard was a TikTok clip from news.com.au, a clip promoting their petition for appropriate rights for those living with the disease, endometriosis. Welcome back to It's About Bloody Time, the podcast where we dig into the issues surrounding endometriosis. In our last podcast, Emma depicted what it's like for a woman living with endometriosis, including some of the symptoms and some of the hardships those living with the condition experience. I'm Michaela Vancura, and today I want to discuss the role that doctors play in the global concern of endometriosis and try to tackle the difficult question I know we are all asking: why is endometriosis so difficult to diagnose? From my last few podcasts, you can remember that for years, women have been living with abnormal period pain caused by endometriosis that affects not only the state of their life, but also the loved ones around them. But not often enough do people consider the emotions that doctors feel concerning this disease and the treatment around endometriosis. Doctors hold massive responsibility in diagnosing and treating patients with endometriosis and are often blamed for the lack of awareness and diagnosis of this disease worldwide. But they might not be the only reason for this seemingly mystical issue. Before we dig into this difficult question, let's do a quick recap on what the disease is and what treatment options are available. According to Mayo Clinic, a nonprofit worldwide leader in medical care research, endometriosis occurs when cells that are similar to the cells of the uterus grow outside the uterus. While pelvic exams and imaging may raise the suspicion of endometriosis, The only definitive way to know if a patient has the disease requires surgery, where doctors remove pieces of tissue and examine it under a microscope to either confirm or dismiss the disease. This disease astonishingly, quote, affects every 1 in 10 reproductive aged individuals, end quote. That means that at least one person in our English 112 class at CMU that is listening to this podcast is living with endometriosis. Sadly, endometriosis is more common than one might believe. One of the reasons why this disease is so complex is our lack of knowledge of the genesis of the disease. So, what actually causes endometriosis?
I wish I could tell you the answer to that, but unfortunately, we don't know. Currently, we think that the likely source of endometriosis is actually occurring during development as a fetus. So when a baby is developing inside the uterus of its mother, that's when we think endometriosis actually starts.
That was Dr. Megan Wason, a minimally invasive gynecologic surgeon at Mayo Clinic. Doctors do not know the exact cause of the disease. However, hopefully this latest research may be promising in shedding some light on how this disease occurs. All right, so let's tackle the big questions I know you are all asking. Why is endometriosis so hard to diagnose? And why is it often misdiagnosed? I have input from a few doctors I'd like to share. The first is from Dr. Tamer Sekin. Dr. Sekin is a specialized doctor in the world of endometriosis and practices in New York. He grew up in Turkey and became passionate about women's rights as he saw the injustice of women growing up around him. His experience gives him both authority and rapport in this topic. According to Dr. Sekin, endometriosis takes so long to diagnose partly because of the stigma around women's periods and the natural pain that comes with it. In Dr. Sekin's words, quote, it's cultural misogyny, quote. Our society needs to stop normalizing abnormal period pain. Sure, it is normal to have symptoms around women's period, but women shouldn't be curled up on the floor crying or missing work because of the pain. Remember Dr. Megan Wason from Mayo Clinic? She agrees. Dr. Wason believes to bring attention and proper diagnosis to this disease, it is critical that we start talking about it. We need to stop telling women that abnormal period pain is normal and that women just need to suck it up and deal with it. Of course, you may be that patient that doesn't get a good doctor who seems to really care or get it. Maybe they're the ones dismissing your pain altogether. If this is happening to you or someone you know and love, make sure to find a doctor who will listen to you. Dr. Wason argues that we need to educate ourselves about this disease so that we can share what symptoms we are truly experiencing to get the help we need and to be an advocate for ourselves. Doctors do play an important role in the diagnosis and treatment of endometriosis, but it is important to note that they need our help as a society to change the stigma around period symptoms to really make a difference and to start diagnosing endometriosis in patients in a more timely manner.
Welcome back to It's About Bloody Time. My name is Jadyn, and in this episode, I'll be discussing how endometriosis affects women to varying degrees in terms of diagnostic periods and rate of occurrence. Differences in diagnostic periods and occurrence, which are more prevalent among minority groups. For instance, according to Katrina Martin, a member of the transgender community, in a statement published on WebMD, members of the transgender community say it's like you're invisible and don't exist in the world. Several members of the trans community say that during and after their transitions, they feel as if the possibility for them to have endometriosis seems to not be considered by medical professionals. A later statement in that same article that I just referenced goes to claim that some small studies suggest that endometriosis may affect more transgender men who report pelvic pain at a higher rate than cis women. Because these are small studies, this cannot be taken at 100% face value, but still can be considered. Continued lack of understanding when it comes to endometriosis in the trans community will perpetuate an already existing problem while compounding its effects in what is already considered a marginalized community. Another instance where the difference in women's experiences with endometriosis is highlighted is within a study titled The Influence of Race and Ethnicity on Prevalence and Presentation of Endometriosis. This study does a great job at highlighting the differences between white and African American women's experiences with endometriosis, specifically within North America. Now, according to this study, when it comes to endometriosis, African American women are 64% more likely to experience infertility, 58% less likely to self-report, 45% more likely to have a surgical case, have made up 53% of cases since 1990, and before that only 47%, and are 49% less likely to be diagnosed with endometriosis. In other words, in North America, African American women on average are more likely to have endometriosis than white women by 3%, but are still far less likely to be diagnosed. This directly leads to a decrease of 58% in likelihood of reporting symptoms. Ignoring the symptoms and not receiving adequate care means that the surgical prevention that is needed in some of these cases is less likely to happen, even though these surgical cases are 45% more likely to exist within the African American community. So all those symptoms that you previously heard listed, the unbearable pain, the fatigue, the anxiety, the depression, the effects on all the loved ones, are all more prevalent, but yet receive drastically less attention within the African American community. Now, continuing on, the Puerto Rican community has had a long history with poor women's healthcare, from the Puerto Rico pill trials that saw Puerto Rican women being used to test birth control and being sterilized without their knowledge, to those same women's granddaughters now suffering from endometriosis with barely any aid in sight. The community has long struggled with receiving adequate women's health care. According to an article published on March 2nd by one of the most used news sources in Puerto Rico, Primera Hora, there are 75,000 women in Puerto Rico suffering from endometriosis. Primera Hora claims that a prevalence of 7.5% of endometriosis exists in women. Yet 7 in 10 women suffer from endometriosis-like symptoms in Puerto Rico without a diagnosis and have to wait 9 years before that diagnosis. Within the adolescent women's population alone, 80% present with menstrual pelvic pain, with 4 out of 10 women in that group saying that pain is severe and disabling. Endometriosis in the Puerto Rican community has proven to be a major problem that is receiving little to no attention. Endometriosis is no longer something that can be simply swept under the rug and ignored because the larger community simply chooses to ignore abnormal periods. Steps in ensuring that every woman receives the care they deserve is one of the most necessary steps that need to be taken in the medical world. The effects compounded on the trans, African American, and Puerto Rican communities are far greater than acceptable and need to be addressed.
Welcome back to It's About Bloody Time, the podcast where we talk about all things endometriosis. So we've gotten a couple questions from our listeners and some other things that we'd like to share in our final podcast.
So personally for me, I am just really invested in men's acknowledgement and how they are affected. So previously, before doing any of this research, I quite honestly didn't even think about how men would be affected by endometriosis. And so after all of this, I mean, it's really compelling to see how this affects everybody and how loved ones are really, really affected. So that's something that I, didn't know a lot about, but it's something that I'll carry with me and continue as we move forward in awareness and things like that with this disease.
Yeah, if you think about it, any other kind of disease or sickness, illness, let's use cancer as an example. Your wife is diagnosed with cancer. It immediately impacts your life, right? Mm-hmm. You're having to go to these treatment centers with her. I mean, you're not just affected immediately, but like if you're the one going with them, you see all of the heartache, the thought of maybe losing your wife, so on and so forth. Like, we shouldn't be thinking about endometriosis as just, something simple. It's a disease just like any other disease or sickness, and it's going to affect all those around the person who has been diagnosed with it.
For sure. With that, I kind of want to see like studies that would look at how the children in the relationships are affected.
Yeah.
And I mean, like seeing mom pretty much completely incapacitated for almost a week, how that has an effect on the children's mental health growing up, and whether or not that makes them more likely to seek help with abnormal periods, or if they're less likely because they realize that their mom is like just kind of hiding those symptoms.
Well, and Mal, I'm sure you covered this in your episode, but it also, endometriosis can cause fertility issues, which, I mean, obviously affects, the men in the relationship, because that decreases your likelihood of having children in the future. I think that's a pretty serious thing to consider, and that perspective isn't really taken so seriously in this topic, which definitely needs to change.
Yeah.
I agree. Going off of what you were saying, Jadyn, I actually did I found another study and interview with women, and some of them said that their kids had to end up, like, taking care of them while they were going through these fights of endometriosis, and how one woman said that her 10-year-old had to take care of her. So that's just interesting to think about, is, like your child has to,
yeah, that definitely adds like a feeling of guilt to it too. Like you're making your child take care of you.
Yeah, I think it's definitely a mental battle as much as it is a physical battle, for sure.
We've had a question come in from our audience on the treatment available for endometriosis. And unfortunately, this is kind of a sucky topic because there's not a ton of treatment available for women diagnosed with endometriosis. According to Dr. Wason from Mayo Clinic, if you remember, the only real way to get rid of that abnormal tissue growth is surgically. And that doesn't mean that it won't grow back. There are some other options like hormonal therapy to try and mitigate the symptoms, the pain, but there really isn't a whole lot to get rid of the disease or to stop it. I think a lot of that is, related to the fact that we still don't know 100% how this disease even starts in the first time. Maybe it's genetic. They know that it's happening at birth now, but hopefully, there will be some more light on the genesis of the disease in the future to come.
Well, it's such a tough topic because when you get diagnosed with endometriosis, or most of the time, you don't even get diagnosed until you have that surgery.
Right.
But like when the symptoms first start to appear and you have that 4 to 11 year delay, like the first option is not going to be surgery. That's super invasive, and doctors are not going to want to perform that right away. But unfortunately, then you're left with just kind of having to treat the symptoms with medications and not really doing much about the pain.
Yeah. So how do we fix this? What needs to happen, guys?
Honestly, I believe first we need to uplift the minority communities, kind of bring it to a basic baseline, because minority communities are already such a disadvantage. Trying to bring it up level that just keeps that disadvantage. So kind of make the care equal now, and then bring up the community as a whole.
I'd say check in with the women in your life. And if you are a woman with endometriosis and you have a partner, check in with your partner. And I think that, male or female, check in with them and just see how they're doing. I think it's just starting those questions of, hey, are you okay? And getting those little things done, because I think those can make a really big difference.
Yeah, I think Emma and I touched on it in our podcast as well. We need to stop normalizing period pain, abnormal period pain. You should not be rolling on the floor, missing work. If you are, you should probably go in. Mm-hmm. All right, like this episode, subscribe to our podcast and share It's About Bloody Time to be entered into a drawing and win yourself a uterus plush pillow. Thanks for joining.